$15 billion stolen from First Nations children. Here's MPP Sol Mamakwa to tell us more.
Mr. Speaker, we are all treaty people. First Nations continue to honor our treaties and to share our land and our natural resources. Mr. Speaker, I want to be very clear. We never ceded our land to the government entirely.
Bonjour. Hi,
how are you?
Good. Like this has really hit home, especially with the Jordan's Principle and First Nations children. Do you want to talk about that?
Yeah, certainly. I think the Parliamentary Budget Officer, like when we talk about Canadian Human Rights Tribunal that, has ordered Canada to compensate First Nations children and families who has been denied service or faced delays in service. And I think that's very important that, that this is because of the Jordan's Principle requires governments to cover the cost of services and First Nations children. And I think to work out any disputes of any issues with jurisdiction. So that's why it's been in place. And I think when PBO, when he actually estimated the Parliamentary Budget Office of about 15 billion, and includes the 13,000 children originally expected to be eligible for compensation, mostly related to delayed approval of Jordan's Principle. Claims that have been happening, and those taken into account of in the care unnecessarily and their families. So I think that's it's when we talk about the system that's there for Indigenous children, we continue to see the racism, the oppression, the colonialism that exists within the fabric of the bureaucracy, the fabric of the federal system. Not only the federal system, but also the provincial system. And I think I made a statement on it because as a provincial member, I am responsible for the riding of Kiwetnuk, whereby the reserves that we have in the community, there's First Nations children that are living in my riding. And I think that's that it was very, it's a very much needed discussion, or it's a much needed I had to be able to speak up on that for these children. And I know when we think about the 15 billion, yes, this is a lot of money, but that it needs to be centered around, the real cost of the lives of First Nations children across the country. This has been far too long whereby we are treated very differently. We are treated, based on the color of our skin, based on the color of where we come from. And I think that's not acceptable anymore when governments continue to say the nice things, say the good things, and act in a way whereby, don't follow the orders that are in place. So it's I was encouraged by the report, but also it's the bureaucracy that's there, and the government that's there continue to treat First Nations, Indigenous children in this way, and that's not acceptable. And I think that's why Jordan's Principle was put in place, because we're not supposed to have we're not supposed to deny services for children just because of the color of their skin, especially when we talk about access to healthcare. And I think the federal government, Ottawa's refusal to immediately, start, they need to be able to start, do the reforms, and then we don't need this drawn out, litigation. We don't need, these higher costs to be able to, where you actually fight children to, actually fighting the courts to be, fighting First Nation children to access services. This is what they should have done from the beginning. And because of the jurisdictional thing, there's no way that he should be saying that that's a federal responsibility. The chronic underfunding that happens in the reserve when we talk about provision of services such as healthcare, child welfare, education, infrastructure, those things, those social determinants of health that are very important for First Nations should be as part of, we should be part of Ontario, not just Canada. They should throw away that game of jurisdictional ping pong that they continue to play with the federal government on the health and the lives of Indigenous children. Because when they are complacent, when they play that game, we know that children, Indigenous children, pay, in full with their health. They pay in full. They pay in full with their lives. And I've seen it happen where 12-year-olds die by suicide far too many times.
Absolutely. Oh, wow. It's been going on for so long. In your words, what do you think it's going to take for them to really start realizing the damage that this is creating?
Yes, the communities, the governments need to support, our communities, our First Nations, the First Nations, to be able to start in a pathway of wellness, a pathway of healing in our communities. And I think, and it's got to be community driven, like me as an MPP or the Ontario government cannot say this is what we're going to provide you with, this is the resource we're going to give you. They cannot do that. It cannot be a top-down approach. There needs to be a process of transforming the systems that are there, whereby it's community driven, and the answers and also the comes from the community. That lead comes from the community, because we need to be able to bring back accountability. We need to be able to bring back responsibility, but most importantly, resource allocation back to the community, rather than having, outside agencies get the funding, because those things perpetuate the crisis in our communities. Programs and services, it makes them look like as if they're doing something where in fact they're not, but actually perpetuate the crisis. It perpetuates the colonialism. And that's why I talk about those three things. Our communities need to be brought up again. We need to stand up as First Nations people in our communities and address these issues. And the answers are within, but we need the support from governments to be able to address these issues. When we talk about programs, services, funding, they come and go. Governments come and go, whether it's provincially, federally, they come and go. But as First Nations people, as Indigenous people, we continue to be here, and we're not going anywhere. And I think it's important for governments to understand that we will continue to be here. And so we need to be working together, for the better good of this province, for the better good of our communities, for the better good of Ontario, for the better good of Canada, and for the better good of as a society, come together and address these issues together. And whether it's the access to mental health, whether it's access to healthcare, better education, infrastructure. We need to come together, and that's what we need to do. And I know, governments say these things, very nice things, but things never happen. We don't see the fundamental changes that need to happen within our communities when we start talking about self-determination, when we talk about sharing, the benefits of signing the treaties, when we talk about self-governance. Governments don't have those discussions. They rather keep us where we are. Systemic racism is not just exclusive to the federal government. We saw this play out in July of last year when Ontario announcement of the child welfare reform, proved to be largely symbolic, but not put any resources to fulfill the need that is required in our communities. And I think that we need, certainly the required true change in our communities that are needed. And no more words. We need more action. We need to be able to see more resources to go to our communities. So it's a very big issue.
No, thank you, Sol. This is a very important message to be shared out there. So Chimigwich.
Nor did we ever give up our sovereignty as nations. Does Ontario believe it is truly living up to the spirit, intent of the treaties?
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.